Hi, I'm Alison Maclean, and today I'm talking to Dr. Lynne Mckinlay, Queensland's Deputy Chief Health Officer, about Queensland's COVID-19 traffic lights and what people with disability can do to keep safe from COVID-19. What is the traffic light system?
The COVID-19 community traffic light system tells people what they should do to lower the risk of getting COVID-19 or spreading it to loved ones.
Why do we have a traffic light system, and how do they decide when it moves from green, amber and red?
The traffic light system is an important part of our response to COVID-19 now that the declared COVID-19 public health emergency has ended. The traffic light system has 3 levels: green, amber and red. When the traffic light is green, Queensland Health recommends you should stay home if you're sick. Keep up to date with vaccinations. Take a rapid antigen test or a RAT test if you have symptoms of COVID-19 and register it on the website if you get a positive result. And wear a mask in healthcare settings or other settings if you're asked to. When the traffic light is amber, Queensland Health also recommends that you wear a mask in healthcare settings or indoors if you can't socially distance, on public transport, and if you are older or around vulnerable people who are at risk. If you consider yourself at a higher risk of COVID-19, you can ask people around you to wear a mask. And you should take a rapid antigen test, a RAT test, every 2 days if someone in your household has tested positive to COVID-19. When the traffic light is red, as well as the other steps we've already talked about, Queensland Health recommends that you should wear a mask indoors. Businesses and venues can make their own rules to keep their workers and customers safe from COVID-19. This includes NDIS and other disability service providers. For example, GP clinics, pharmacies or allied health settings may require you to wear a mask to enter the building even if the traffic light is green. If you or someone you care about and care for considers themselves to be at higher risk of COVID-19, the best thing you can do is to be vaccinated, wear a mask and keep your hands clean. The traffic light system was put in place to support the community against COVID-19. The traffic light system provides advice to the community and business to help lower the risks of COVID-19, especially when a lot of people in the community have the virus. Queensland Health decides when the traffic light will change colour depending on the number of active cases, how many people are in hospital and how quickly the virus is spreading through the community. The Chief Health Officer considers all of the above when making a recommendation to the Director General of Health about whether to change the traffic light colour.
We keep hearing that the public health emergency has ended. Can you tell us what this means?
Even though COVID-19 is still a risk, it is no longer an emergency. Now we treat COVID-19 in much the same way we treat other diseases. We did this because we are now better prepared to respond to COVID-19. Many people are now vaccinated. The Omicron variant is less dangerous. We have antiviral medications and our health system is ready to help people who need it. When the public health emergency declaration ended, so did our public health directions. That means that some of the rules about vaccination and isolation have changed.
Should I get another vaccination? What are the new vaccinations?
It's important that you stay up to date with your vaccinations. Talk with your GP, pharmacist or other healthcare provider about staying up to date with vaccinations. Currently, the Australian Technical Advisory Group on Immunisation, that we call ATAGI for short, recommends getting a 3rd and 4th vaccination dose as well. The 4th dose, also called the 2nd booster, is recommended for adults who are at higher risk. This includes people who are immunocompromised or have a disability with significant or complex health needs or have severe complex or multiple health conditions. Immunocompromised means someone who has a weak immune system and is more likely to get sick. It is also recommended if you are 50 years or over that you get the 4th dose, as you might be at higher risk. If you are unsure about what booster you should get, you can talk to your GP who can help you. You can get a vaccine from most GPs, community pharmacies, Commonwealth vaccination clinics, and Aboriginal and Torres Strait Islander community-controlled health services.
What are antivirals and how do you get them?
Antivirals are medications that can help your body to fight off viruses. The Australian Department of Health decides who is eligible to get antivirals. Antivirals for COVID-19 are available for people who are at higher risk of getting serious illness once they test positive for COVID-19. Antivirals will usually be given to people who test positive for COVID-19 and are also 70 years of age or older, 50 years of age or older with 2 other risk factors for severe disease. If you identify as a person of Aboriginal or Torres Strait Islander origin and are 30 years of age or older and have 1 other risk factor for severe disease. Or if you are 18 years or older and immunocompromised. Risk factors for severe disease include diabetes, being overweight, serious heart disease, chronic respiratory disease, chronic kidney disease, and a number of other serious health problems. If you test positive for COVID-19, you should contact your GP for advice about if you are eligible for those antivirals. If your GP recommends antiviral treatment for you, they will need to give you a prescription. The medications are available at your local pharmacy with a prescription. Your GP can send the pharmacist your prescription electronically, so the medications can be either collected by you, a friend or a family member, or delivered to your home. The Pharmacy Guild of Australia website provides a list of which pharmacies have antivirals and their supply based on your postcode. You can also call your pharmacy before visiting to make sure they have the medication in stock. I recommend that you plan ahead and talk with your healthcare provider now about what to do if you catch COVID-19. This could be your GP, your nurse practitioner, or your treating specialist. Talk with them about how you will get a prescription for antivirals if required. This might also include how to contact them if you test positive, how to provide evidence of being a positive case, and how prescriptions will be provided to you. Antivirals are most effective if taken within 5 days of when you first have COVID-19 symptoms, so it's important that you have a plan with your GP or health provider about what you will do and how you will access antivirals if you test positive to COVID-19. Remember, a GP cannot prescribe antivirals without a positive COVID-19 test, so planning is important. We understand that it can still be difficult to see your GP if you have COVID-19 symptoms or if you think you have COVID-19. If you make a plan for antivirals before you may need them, then this should help. If you don't have a regular GP or you can't get an appointment quickly enough to talk about treatments, you can call Health Direct's free national coronavirus helpline on 1800 020 080.
When I get COVID-19, what happens then? Can I get hospital in the home?
The process for reporting your positive COVID-19 RAT test is the same as it was during the pandemic. You can register your RAT at the Queensland Government website. Just Google Register RAT Queensland to find the website. You can fill out the form in about 5 minutes, or a carer can fill out the form for you. If you need help, call 134 COVID or 134 268. Once you have reported your positive COVID-19 RAT to Queensland Health, you should continue to isolate at home and monitor your symptoms. If you are unsure about how to manage symptoms or get advice, you may contact the National Coronavirus Helpline, which is a 24/7 service, on 1800 020 080, and they'll connect you to healthcare professionals. Also, let your health professional know. Contact your general practitioner, local medical practice, or your usual specialist. However, please remember, you can always call 000 if you have severe symptoms to make sure you get the right care. The Hospital in the Home service is still available at Queensland public hospitals and is used to deliver healthcare for all Queenslanders. Hospital in the Home can continue to be used to care for patients who have COVID-19 and who are well enough to be cared for at home.
What are the rules for people who self-manage their NDIS plan?
All NDIS participants should talk to their workers about how they want to keep safe from COVID-19. If the person tests positive for COVID-19, they should let their workers know and encourage workers to wear protective equipment like masks, gloves and eyewear for any essential interaction while they are unwell. If a self-managing NDIS participant directly employs their workers, they may choose to only hire vaccinated staff. If you have concerns about how a service provider is keeping you safe from COVID-19, you can raise this with the NDIS Quality and Safeguards Commission.
And what about people who live in homes with 4 or more people with disability?
There are no longer different rules for homes with 4 or more people with disability. The organisations who run these homes need to make sure they keep everyone safe, but they now have more choice in how they do that. Queensland Health has published guidelines for managing infection prevention and control that other organisations can also use to make their own rules to keep people safe. Queensland Health has chosen to continue requiring its staff to be vaccinated.
Last question, Dr. Lynne. If anyone is feeling worried about COVID-19 or still has questions, where can they go?
The Disability Gateway helpline is a great first step. You can call them on 1800 643 787.
Thanks for your time today, Lynne.
Thanks for having me.
Anytime.